Medical terminology for Introduction to Nursing Concepts, the Oxygenation and Perfusion Unit. This is Martha Olson. When we ventilate is to breathe. When you hyperventilate, it's breathing fast. Usually somebody that has an anxiety attack, or if they just went and ran, they might be hyperventilating or breathing fast. Hypoventilate is breathing slow, and that can be from a variety of reasons. It can be from medications like narcotics that cause hypoventilation. It can be from somebody not taking a good deep breath because maybe they broke their ribs and it hurts a lot to take a deep breath. So it can be for a variety of reasons. Atelectasis is not expanding those alveoli completely and can cause problems with exchange of oxygen and carbon dioxide. So atelectasis is not a good finding on your assessment. When we listen to the lungs with the stethoscope, we auscultate. Auscultate means to listen, and as you can see from the pictures, we listen or auscultate 8 times in the front, 10 in the back or posterior, and 4 down each side laterally. Kyphosis is the curvature of the spine. We know that that is important and often seen in the elderly as part of the aging process. Oftentimes it impacts their ability to take a good deep breath. It decreases the volume in the lungs when somebody has kyphosis, or that other name for it is called Dowager's hump. Exacerbation is to get worse. We think of exacerbation of somebody's COPD or chronic obstructive pulmonary disease. When it gets worse, it can be for a variety of reasons. Maybe they didn't take their diuretic. Maybe they went out and it was very humid outside. Sometimes just an exacerbation can be from starting to smoke again or being around secondhand smoke. As you can see from the picture, the man that has exacerbation of his COPD, he's easily fatigued, he's wheezing, he's got his oxygen on, he's sitting up in that orthopnea position with his tissue for the thick sputum that he is trying to get rid of. Broncho is normal breath sounds. Broncho is a combining form for bronchus, and when we think of the different types of breath sounds that are listed in Potter and Perry, we know that vesicular is heard over the periphery. Bronchovesicular then is a normal lung sound as well. It's between the scapula and the bronchioles lateral to the sternum, usually first and second intercostal space, so it's down a little further, and then your bronchial is heard over the trachea. Epistaxis, epi is on top of, above, upon, and it is a Greek word meaning falling from the nose. Epistaxis is a nosebleed. It's usually caused by things like dry environment. People in the winter time get nosebleeds more often. People that are nose pickers, or they're on a lot of oxygen, which is very drying. Small arteries rupture, causing that nose to bleed. The people that we worry about with a nosebleed or an epistaxis are your people on blood thinners, your Coumadin, heparin, aspirin type products, because they will take longer to clot. Semi is half or partly, and so when we talk about positioning a patient and we say put them in semi-Fowlers, that means to put them halfway sitting up, not sitting straight up, not laying flat, but kind of in the middle. It is the direct opposite of Trendelenburg. When you lay a patient Trendelenburg, their head is down, their feet are up, and it's usually a rescue position because we want to try to get the blood flow down to the heart, brain, and lungs that are our vital organs. Talking about edema, you can see this person has a lot of edema in their extremity and to the foot. The lower extremity is the most common place for your edema because it's so far from the heart, and it's a dependent extremity. When you put your feet down and sit in the chair all day, it takes more energy and more blood flow to kind of pump it back upstream into the venous system and out. It can be from fluid overload. It can be related to fluid and electrolyte imbalance, like too much sodium, and we know sodium attracts water. Congestive heart failure, where their heart as a pump is not effectively working, and so edema is a very common thing that we see in hospitalized patients and in the elderly. We see that the skin is very tight and shiny when they have edema because it's pulling into that interstitial space. So that skin is very fragile, and when we look at edema, we think that skin can break down very easily. We need to take some precautions to keep that skin healthy. When we use the word turgor, when we check the skin turgor, we're pulling up on that skin to check to see how elastic the skin is, and that is also an assessment tool that we use that helps us to look at the hydration status of a person. When we look at edema, we know there's a scale. +1, it only pits down about 1 centimeter or less. A +4, +5, there's a lot of edema in that extremity or wherever you're checking or assessing, because it can indent down 4 centimeters. We know there's a lot of different causes for the edema. The biggest thing with edema is what's causing it and how can we change or improve that. Hyper and hypo are opposites. Hypo is below, hyper is above, and you will see these prefixes used very often in this semester. Hypoglycemia, the blood sugar's too low, it's below 70. Person is shaky, sweaty, has a headache. Sometimes they can be unresponsive if it's low enough. Hyperglycemia, they've got a lot of sugar on board and they're going to have dry skin, they're going to have a dry mouth. And treatment is the exact opposite for those two conditions. Hypotension is where the blood pressure is low. Maybe a patient has a blood pressure of 88/60. That would be termed hypotension. A lot of reasons somebody might be hypotensive. They can be a hypotensive because they've had blood loss. Perhaps they're on blood pressure pills that are working too well and they're becoming toxic to them. And then your hypertension is high blood pressure. That can lead to strokes, that can lead to other very unhealthy conditions in the body if hypertension is not identified and treated in a timely manner. Hypertension, 128/85, I think, is kind of the parameters for what is hypertension. When we look at clubbing, we know that clubbing is a long-term complication of hypoxia. Clubbing is the rounding and the different shape to the digits or the extremities of the fingers. You see that in older adults that have had respiratory issues for many years. You also can see clubbing in young people. Children that are born with respiratory problems and they suffer from a lot of hypoxia through their life can develop clubbing very early. Percussion is to tap. You might have heard the word percussion section in the band where they're the drummers. When you percuss like over the bladder, you're looking or trying to hear, is there fluid in that bladder or has it been emptied and eliminated? And you can tell by the pitch. So when you tap one finger onto the other finger that's on the body, you can percuss or hear things. They do it over the lung to see if there's a tumor or fluid in the lung. Usually it should be a high-pitched percussion that you hear over the lung field because there's air in the lung, so it's very high-pitched. To palpate means to feel. The picture on the left, they are palpating the thyroid gland, and the picture on the right, he is actually palpating the abdomen, possibly under the ribs for the liver or the bladder, looking to see is there a mass, is the bladder full of urine. So we can palpate or touch a patient and kind of feel what's underneath. So it's a very superficial way of being able to tell structures. Bilateral means both sides. So if I have bilateral edema, that means both of my feet have edema. Bilateral club feet in casts is your picture on the left, and you have a child here with a bilateral cleft lip. So he's got two sides that need to be repaired to improve the look for that child with the bilateral cleft lip. Dyspnea on exertion. Dyspnea means short of breath. DYS, anytime you see dys, it means painful, difficult, abnormal, and there are many other dys words that we use in Introduction to Nursing. You can have dysmenorrhea or difficulty or painful menstruation. So when you see dys, you know that it's abnormal in some way. In the elimination unit, you might see the word dysuria used for that unit. As we look at cyanosis, we know there's two different types. Central cyanosis is much more serious because it means the core of the body is not getting oxygen. This little baby has some central cyanosis and needs some oxygen. Peripheral cyanosis is out to the extremity or the periphery, and that is also concerning. because we know that those tissues are not getting oxygenated well enough. So we have cyanosis, meaning tissues are not getting oxygenated, and that's very concerning for us, and we know we need to do something to treat them. And our last word is how to breathe, and we know there are different terms that you will see as we look at oxygenation and the process of breathing. EU is normal. So when you have eupnea, that means normal breathing. 12 to 20 times a minute, they're not dyspneic or short of breath, and everything is working well. When it's too fast, it's either hyper or tachypnea. When we look at tachypnea, reasons why people may breathe fast is trying to blow off some CO2. Maybe they have a metabolic condition going on. Bradypnea is concerning, very concerning, because they're not going to get enough oxygen and perfusion to the tissues, and so when somebody's breathing too slow, we need to find the cause, and we also need to treat them with either bag mask to help force air in, or some kind of intervention with oxygen to help them. Cheyne-Stokes is a condition that we notice in your patient that's dying. It's where they have a period of apnea, and then they will start breathing again, and then they will have a period of like 20-30 second apnea. It's kind of the body's way of starting to shut down. As a nurse, we look at that and let families know that perhaps your family member is getting closer to death, your hospice patient, when they have Cheyne-Stokes. And then Kussmaul respirations are very deep and very fast, and that is usually in your diabetic that's having a high blood pressure or a high blood sugar, and Kussmaul respirations are the body's way of trying to correct the acid-base imbalance. So as we look at some of the terms for the oxygenation unit, we know that understanding them will help us to apply this information in a positive way. I hope this was helpful. Have a great day.